Because of the large number of, let's say, Buddhist, like Kuokini Medical Center, large number of Buddhist patients, they were hesitant in having Christians come in. That was the hardest barrier that we had to kind of go over, that we were not there to evangelize, that we were there to meet the needs of patients.
The reason the model of having a common agency was appealing to the hospitals here is because of all the religious differences that exist here. So how would we address all this diversity? So Pacific Health Ministries always had connections with all those religious communities. Also, intentionally, always had a very diverse staff, culturally and religiously, to meet those needs.
Pacific Health Ministries became a CPE training center. It was all year round, and the extended program would lead it more.
Over the years, we've had, I don't know, somewhere in the neighborhood of 600 or 700 students.
We had people from all different places, from Indonesia, from Malaysia, from Korea, from Guam, and so we were able to see it, and that's what we wanted to see.
Pacific Health Ministry started was the goal and the mission to provide the highest quality interfaith spiritual care. That's what it was from day one, providing spiritual care to the people of Hawaii and also interfaith spiritual care education as well as education to the broader community.
People suffer not just in the physical, but also in the emotional, the social, and very much the spiritual domains. So in order to really minister to that kind of suffering, Pacific Health Ministry and their chaplains are just absolutely essential on our healthcare team.
I'm old enough to have seen generational shift in the attitudes of doctors and nurses from where clinical chaplains were seen as something that's nice to have, that I think the majority of healthcare professionals now realize that it's really an essential.
Just being able to be with patients and families when they're in a situation that they're totally out of their element in, they have no way to navigate, they have maybe even no family and nobody to share their fears with. Those are the kinds of stories I hear every day.
What we're talking about is the best that I can do in my role as a chaplain is to listen and to be present to what people are saying, what gives them meaning, what gives them hope, what do they value. It's not about me or other chaplains, it's really about the people that we serve. And of course the people that we serve are not only patients and patient family members, but their physicians, their staff, their housekeepers, anybody within the hospital system. We will reach out to, we will listen to, and we will honor what's purposeful to them.
So chaplains are with us 24/7. We have somebody on site 24/7. And at night, when it's quiet and not much else is going on, that's often when patients have time to be thinking about what they need. It's often time when there's not quite the busyness on the floors, so our chaplains will round on the floors and visit with staff and ask them how things are going. And it's in those informal, real-time conversations that staff are able to utilize the chaplaincy services. To have that name known by all, my wish for Pacific Health Ministries would be that their name is equally known by all across the state and across the Pacific region. So I'd just like to say congratulations for 30 years of dedicated service to Pacific Health Ministry, and I'm wishing you 30 plus more years. Thank you for all that you do.